After a 3-day series on drug shortages in this country, Meg Terrell has received calls from viewers who can't find Adderall, the drug that helps people with attention deficit hyperactivity disorder. She joins us now with more. Meg, how bad is it? And why can some find it and others can't?
Yeah, Joe, it's just this sort of lumpiness in the supply chain. But this shortage is driven for different reasons than the ones we examined earlier this week. And millions of Americans, both adults and kids, take things like Adderall for ADHD. And this shortage has been going on since last summer. It's driven by things like demand increases during the pandemic, an increase in the telehealth use and prescription of these, as well as involvement from the DEA. So according to the FDA, of 9 manufacturers who make Adderall, generic Adderall, 6 are reporting tight supply. 2 cite the reason as demand increases. 2 say there is an active ingredient shortage, and the estimated availability ranges from March to June, at least according to this FDA database. Now, a CDC study just came out yesterday showing the increase in ADHD, or at least prescriptions for stimulants during the pandemic. It went from about 3.6% of all the people they studied in an insurance database back in 2016 to 4.1% in 2021, with the biggest jump there you can see during the pandemic. And of course, there were changes in telehealth use and rules where telehealth prescribers didn't need to see patients in person in order to prescribe these drugs. The CDC saying in this study, quote, the combination of potential increased need and reduced barriers to access prescription stimulants might have encouraged more adults with ADHD symptoms to seek diagnosis and treatment. So we've been reaching out to the companies to try to understand what's going on here. Teva and Novartis' Sandoz are some of the bigger makers of these generic versions. Teva notes unprecedented demand that it's seeing here. It did have a manufacturing hiccup last year, but it says that is no longer affecting things. Sandoz says that they expect the entirety of 2023 to be tight on supply for this product. Part of the thing here, guys, is the DEA controls how much of this ingredient that goes into Adderall can be made by these companies. And so they have to request a quota from the DEA. Novartis says it did increase how much it asked for 2023, and it was only granted part of the increase it asked for to be able to be made. So this shortage is expected to continue, unfortunately, and it just sounds like it's incredibly frustrating for people who really need this. Guys?